The following program has been furnished and paid for by the Health and Wealth Power Hour, and KSCB is not responsible for its content or the product or services offered.
Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlon Pickett. A show about how you can live longer with more cash and flexibility to really enjoy those years and never run out of money. Harlon will take your calls on a variety of topics related to health insurance, health care, retirement income planning, Social Security, thrift savings plan, 403B, 401k, or just about anything that gives you the tools to take action on keeping more dollars in your pocket and putting more dollars towards your retirement. He'll even share a few industry secrets if you listen close. And now, here's your host, Harlon Pickett.
All right, welcome aboard. Health and Wealth Power Hour with the aforementioned Harlon Pickett. It is great to be with you today. Appreciate you taking time out of your Thursday to join us. A lot of folks have been reaching out, asking questions about all the craziness that's going on right now with the AEP, the annual enrollment period for Medicare, and of course, right around the corner, we do have the open enrollment for Obamacare for ACA plans. And I'll tell you, it is going to get crazier and crazier as we have these new companies coming in and offering plans. And the interesting part to me is as I look at some of the offerings that are coming in, they're kind of generic in what they're showing us right now. But most of them are telling you, hey, about 80% of these folks that are going to have availability to this plan will be able to get it for less than $10 a month. Well, maybe. It's kind of interesting that they can put that out there at this point without knowing what our true tax credits are going to be for next year, because all of that, as I've mentioned to you guys before, is going to be determined by the lowest cost silver plans in an area. And that's not even been released yet. And of course, we don't have any idea what our tax credits are going to look like. So how can you tell me how much your plan is going to cost? The other thing that's very misleading on some of these, of course, is the fact that whenever you put that information out there, that truly doesn't mean that that plan is going to be that price, because or a plan that you would want would be that price, because typically what they're talking about, of course, is their lowest end plan that's going to have a high deductible and very few benefits. So as you look at this and as you see a lot of the commercials coming up for some of the plans coming possibly to your state, just remember, take that with a grain of salt. Make sure that you are talking to someone to help you through that process, because they certainly haven't made it easier to understand on healthcare.gov. And, we're really blessed today that we're going to have an awesome guest with us here in just a few minutes, that if you're tired of dealing with all of these things through the health insurance world, if you're just sick and tired of all of the confusion and dealing with ACA and just all the mess that comes with all those balance bills, all the things that come later, well, we didn't quite get enough money from you, so we're going to need a little bit more. If you're wondering why maybe you're paying more for services than somebody else is, and, I just read a report this morning talking about oncology services in particular, and that how private insurance companies are allowing hospitals to charge substantially more than what Medicare allows. So what you're seeing then is someone that's on Medicare is paying less for the exact same service as someone that's on a private insurance plan. And that simply just doesn't make any sense, because it doesn't cost anything different if you had a different provider. That's nonsensical. We all know that the cost of something is the cost of something. It shouldn't change because you have a different insurance carrier, or you're not on Medicare, you're on a private insurance instead. But then I've also mentioned to you multiple times that there are always cash discounts. Cash is king. But the more interesting part of that is how many times you find out that they won't even accept cash. They won't even tell you how much something would be. I mean, how can that how is that even possible? Obviously when we had Dr. Keith Smith on here a couple of weeks ago from the Oklahoma Surgery Center, we talked about that quite in depth, and he made it clear. You can certainly find out what the price is for any service that is offered out there because they know the data. They know how many times they've done this particular process, this particular surgery, or whatever it was. They know what it's going to take to do it. But because it varies so much depending on what kind of insurance you have, the true data is not always there. I think that you see how much administration is in place at doctors' offices and also at typical hospitals. When you see all that administration, you see why the costs have to go up so much, because it takes forever to get anything processed. And then, of course, it takes them forever to be paid. So you would think they would be much more open to taking cash. And we are seeing a turn in some of the hospital systems now because of the success of Texas Free Market Surgery Center, Surgery Center of Oklahoma, some of the other facilities that are now allowing price transparency, that are allowing true package pricing and direct pricing to consumers. Now that we're seeing that more and more being acceptable across the country, we are seeing facilities that are willing to do that. There are obviously some still major holdouts across the country, but we are seeing it being much more accepted. The guest that we're going to have today with Laso Health is that the app that they created is a direct result of doctors and facilities wanting to go directly to the consumer with prices that are public. They're published. They're out there. You can get right on your Laso app, and you can see that information. I know I've mentioned the app to you guys before, but we're going to learn a lot more today about how the app came about and all of the cool things you can do on it. I'm also going to share a story of how we've used it, because we saw the app. We thought it was a great thing. We went through the turmoil of trying to find out what the cost of something was by trying to use our insurance plan, and it was I don't know. It was just a nightmare. No one could tell you anything. Okay, we're going to cover 50%. Okay, well, what's the 50%? What's the cost? What would our part be? Well, we don't know. We won't know until you have the procedure done. Wait, what? You've got to know. And we're not talking about a major procedure here. We're talking about my daughter needs to have her wisdom teeth taken out. And you can't tell me how much that would be? I mean, I can look up online and see it's going to be kind of between here and there. So it could be much more than that. Well, why? Well, we can't tell you until you get it done. Wow, that sounds like the dadgum Obamacare law to begin with, right? We can't tell you what's in it until we pass it, and then we'll let you read it. But it was such a frustrating process that when we came across the Laso app and we were able to go through that process, man, it was just so simple and straightforward. So we're going to talk a whole lot about that today. We're going to talk about what is really moving into the commonplace now. And the Laso app is one of the main things that will help you move that direction. And while it is almost exclusively in the San Antonio area now, it is expanding into Houston. And with your help, we can make that happen too, so that you can have access to the great parts of that also. Harlon Pickett, Health and Wealth Power Hour. We'll be right back.
Whether you're an individual or a business owner, Eagle Care offers health plan payments around half of what most are paying in traditional insurance premium plans. Plus, you'll have the control to choose providers from one of the best provider networks in the nation.
During COVID, we had great coverage for our whole family. The day I signed up, we had a welcome call, and it was so personal and genuine. Plus, we went from $1,500 to $690 a month with Eagle Care. Thanks.
That is the Eagle Care way. Reclaim your freedom to choose and soar high above the rest. Find us online at eaglecarehealth.com. Eagle Care Health Solutions. It's not insurance, insurance, it's better.
Money Matters with Steve Drake.
Hey, Dennis. Hi, welcome to KSCV. Good morning.
Hey, I listen to a lot of talk shows all over the AM stations, and I wanted you to know that you are by far the most creative, informative talk show I listen to. I'm one of your 100 very loyal
Oh, my
listeners.
gosh. That's so nice. I'm honored you listen, and I'm flattered by your compliment. Thank you.
Weekdays 11 till noon on AM 700 KSEV. Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlon Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
All right, little Frankenstein getting ready for Halloween. I like it. All right, Harlon Pickett, Health and Wealth Power Hour. We are back. Join us today from Laso Health, Tim, the COO. Tim, what's going on today, buddy? Hey, Tim, you with us?
I am.
Hey, all right, Tim. Thanks for joining us today, buddy.
Yeah, hello, Harlan. Thanks so much for having us on. We appreciate it. What a great program you have here. I love it. I love the focus.
Yeah, absolutely. Hey, it was great talking with you yesterday, and I know that one of the things that is so innovative about this is the fact that you can go with your Lasso app, go shopping. I mean, it's the Amazon of healthcare, as it were. You can go shop and you can find your procedure, and you can pay for it right there on the app, and that's just cool, man.
Well, cool and kind of crazy, huh? It's kind of crazy. It was the vision. You know, our founder, Dr. Mazzani, he's a practicing physician in San Antonio. That was his vision. The spark for this was he was sitting on his couch and booking a trip literally around the world from his phone, and he's thinking to himself as a doctor, why can't I do this with healthcare? And as we look at what we're spending 1/5 of our GDP on, nobody knows what it costs. That's a problem. Even doctors, you know, they get lumped into this thing. But I think, as you were talking about earlier, even asking the question, you know, nobody can tell you what it costs. And you know as well as I do, that's because those things happen after the fact. And anything else in life, we would never go and buy something, you know, that we didn't know until after. I mean, could you imagine an $80,000 SUV? You know, you're thinking to yourself, like, well, what's the real cost going to be? Well, you wouldn't take it off the lot. And so, that you nailed it right on the head. The Laso app was envisioned and built to provide a portal to buy things the way we do everything else in life. It's 1/5 of our paycheck and every year. And since the passage of the ACA, man, buddy, deductibles have gone up 162%. And, you know, even those of us that have insurance, you know, over 50% of us are functionally uninsured. If your deductible is higher than your savings, you don't really have insurance, you know, if something major happens. So, we're looking to cure. That's where the name comes from, Greek goddess that cures and remedies. And with Laso, we're really looking to cure at least this part of the healthcare system.
Yeah, and you know, I think that we are trained from a very young age, especially in this, you know, the last few years, all the years preceding us at this point, that all we have to do is show up with an insurance card in our hand and everything will take care of itself.
Yes, sir.
The problem with that is, as we know, the surprise bills, the balance bills, the whatever you want to call it. You've paid your copay or whatever, and you think you're done, and then a few months later, you get the rest of the story, as Paul Harvey would have said. All of a sudden now, well, what's this $230? What is this? I thought I paid my copay back there. Well, it's exactly what you were talking about a moment ago and I alluded to earlier, and that is they don't know what the cost is until they go through the whole process with the insurance company and see what they're allowed to bill you.
Right, right. I always think of the copay as the parking fee.
Yeah.
That's all it is.
Yeah.
But people, you're absolutely right. It's no fault of anybody listening that we've been conditioned. You and I talked about yesterday. I was a Teamster back in the late 80s, early 90s, and I had a Cadillac healthcare plan. And ER copay for me was $25, and I never saw another bill after that. Well, in 2009, the rug kind of got pulled out from under everybody, and without changing mindsets, we go in and as you and I talked about, you're usually greeted with insurance card and ID before hello. Right. And once you hand that card over, you're in that system, and I've heard it referred to as the dark machinery, because that's what happens. You talk about balance billing, that's what happens behind the scenes. And you mentioned, again, going back to those doctors and providers, dentists, 20% of their staff cost is just trying to collect money. Right. And so they're we've gotten such an amazing response from physicians, and I would say above 90% of the physicians that we've gone out to talked about the Laso app, and we've been out in the market now for about 5 or 6 months. Over 90% of them have said yes and signed on, and we've signed on some pretty big groups in San Antonio. They're all hungry for change in this too. They're tired of the business side of this and what it takes to get paid. So I think some of the difficulties have been, number one, packaging it for a consumer so it's easy to understand. And with the Laso app, we have focused so much on simplicity. We want to take the quote, scary out of healthcare, because recent Harris poll said that 55% of people will defer care due to cost uncertainty. And if you think about that stomach ache you have today, you defer, and then what happens? Well, 5 days later, you're in the ER having your appendix removed. And now what do you have is what you were talking about. You have a situation where you've got $50,000 or $20,000 worth of bills, and we shouldn't be scared to see a doctor because of the cost or the convenience. So with Laso, we really focused on simplicity and like you said, making it. You talked about it being simple, and we appreciate you as a customer as much as a friend now. Is just that we have focused on that. We want it to be as easy as hailing an Uber or booking a restaurant table or all the other things we're used to in life. Healthcare should be that.
It really should, and there has been some innovation in that part of it through even some of the insurance companies like Oscar, making it much easier now. They are very good on their technology side as far as letting you book appointments and look at your blood work, those type things. The problem is you still have those same issues on that balance bill, that they still make it easy to set that appointment, but you don't know, I hate to say it, but they're still part of the cartel, right? I mean, that's still all the things with the insurance. They're all they're all still part of the cartel. It's all going through that same machinery, like you talked, the dark machinery, as it were. And that's just what we've always had. And that is an interesting thing. You told me a story about a friend of yours in Singapore that had gone to the doctor, and he told you what the process was there, right? So why don't you share that with us, because it's a very short story, though.
Well, it's pretty funny because we're a startup, and it was actually a venture capitalist, and I think it was 8 a.m. there and 7 p.m. here, and we were on a Zoom, and I asked him, I said, well, what's healthcare like? He had lived there for 3 years. He's originally from California. Been living there for 3 years. I said, well, my daughter fell down and scraped her knee. I took her to the doctor. Doctor saw her, treated it, put some bandage on it, and on the way out, the nurse already had our antibiotics ready to go, our topicals ready to go. Everything was done. He said, and they charged me X amount of dollars. I paid it, and that was it. That was healthcare. And in the United States, it does us all well to remember that was healthcare prior to World War II. Health insurance came out of the war, and it was a means of retaining employees because all our young, a lot of our young men went over to serve, and so we were asking women to enter the workforce. And, kind of like it is now, we really had to make some benefits. So that's where health insurance started. But then it grew into this monster. And when you talk about things like Oscar, I kind of think about those things like Carvana. It's wrapped in tech and it's everything else. But in the end, it's still a car dealership, right? And it has a little more convenience and everything else. But you're not fundamentally changing, and it hasn't needed to be changed the way it has in healthcare. This is unsustainable, what we're going through. But, the way he described it is the way it used to be, which is what Laso is direct access healthcare. We don't think that you should have to call the office to find a convenient time. The time should be right there for you. We think you should know the price up front, and you'll never get another bill. That's the Laso promise. It's part of our provider agreement. They're not allowed to send you another bill. They're not allowed to submit you to insurance. And then the third piece is direct access to a specialist. If you're playing softball on the weekend, you tweak your ankle and you just want to go see an orthopedic, or maybe you want to get a second opinion, for your father that has a cardiac issue, and you just want to pay a cardiologist for 30 minutes of his time. Laso allows you to do that. And if you want to do it at 2 p.m. tomorrow or whatever, it's right there in front of you. There's no call in the office, checking your calendar. Again, it's healthcare. And we just added, we talked about it yesterday. We're adding house calls now because we've got companies approaching us. So we added a house call category because in Texas, especially the ambulatory groups, and the PAs and they're getting a lot more medical leeway, if you will, to practice. And so there's a lot of mobile solutions out there. So, man, you could even have it come to your house, kind of like Healthcare Grubhub, I guess, if you want to think of it that way. Because we're talking about apps and stuff. But really, that was Dr. Mazzani's vision was, man, I can do all this stuff on an app. I'm a doctor, and you can't do anything like this in healthcare. And there's really no reason that you can't. So we're proving that.
Yeah, there really isn't. And I think it's interesting what you talked about earlier is that doctors are not saying no, because what's there to say no about? You're taking away the administration part. They're not having to worry about waiting months to get paid. Mm-hmm. And, a lot of the work is done on the front end by the app. There's just not a lot of reason to say no, unless, of course, you just don't want to take new patients or something such as that.
Right.
But, really,
that
that
was one
is.
of our no's. We had a San Antonio physician that's been here forever, and he's beloved. And I had a very open, honest, great conversation with him. And he said, hey, man, I'm 70. I just want to retire. But he also told me, listen, there's an ocean of people out there that want to pay cash for health care.
Yes.
A lot of them are underinsured and underserved communities, and I think, I was thinking when you were doing the intro, I was thinking about the fact that my doctor always told me, go in, when you walk in, don't hand over your insurance card, ask for a cash price list. And he told me that years and years and years ago, but he's a concierge doctor now, and it shouldn't be limited to your means or anything else. We want to democratize that with the app. The app is free. It's free to use. And so, you download it and you can shop prices, but most importantly is that we're democratizing the knowledge, man. We're stripping away all of that mess in the middle, the middleman, if you will. We're stripping that away and connecting you directly with the physician, and that's what we call direct access healthcare. Is that there's nothing in between you two. And when you talk about the physicians' offices and how much they love this aspect of it, when somebody books an appointment on Laso, as you did, that money goes into like an escrow account. After your daughter's service is performed, and that's an amazing. Dr. Havergorn's an amazing oral surgeon. After that service is performed, he'll have his remittance within a couple of days. I mean, it's just a matter of the time for the bank to process it. Right. So there's no billing, there's no collection, there's no nothing. I mean, it's literally, and they don't have to handle cash, because that's been the other barrier, is that people wanting to pay cash, we're actually trying to pay cash. And I think for better or for worse, I just see myself using less and less actual cash. And so the app really makes everything easy for everybody.
Yeah, that is great. I'll tell you what, Tim, we're going to take a break right now. When we come back, I want to dig a little bit more into this, and I'm going to talk a little bit more about what our feeling has been in using the app, and kind of, my wife had taken my daughter over to see that doctor, and so her feelings about it, because at the end of the day, right, if the wife's not happy with the process, well, we all know how that's going to turn out. So, all right, Harlon Pickett, Health and Wealth Power Hour. We'll be right back.
Got FESA? That's the Federal Employee Service Association. Find out what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlon Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Catch Chris X Radio weekdays at 4, right here on AM 700 KSEV.
As crime ravages our city, just remember that Mayor Turner has it all under control.
Until the coronavirus is resolved, criminals take a break and don't commit any crimes. So everybody chill. Crooks, criminals, you chill. Wait till the coronavirus is over.
Why didn't anyone think of this sooner?
Chris X Radio, weekdays 4 till 6, right here on the Voice of Texas. Got a question for Harlan? Phone lines are open now. Call 281-558-5738. That's 281-558-KSEV.
This is Harlon Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
Oh, yeah. We are back. Harlon Pickett, Health and Wealth Power Hour. Thanks for joining us today. We have Tim over at Laso Health with us today. They have brought out this super cool app where you can shop for medical services. You can schedule your services and pay for them right there without the fear of getting a bill later. We use this app for my daughter's need to have her wisdom teeth removed. And it was a really cool and easy process. We set it up. The doctor that we chose, or the oral surgeon that we chose, is about 5 to 6 miles away from our home. They already went for the initial consultation. Everything went very, very well. We're not talking about, you're signing up with a doctor that's you got to go to the back room or something to get. There's a special back door for the people that use the app or anything. It's a reputable, well-known oral surgeon here in the San Antonio area. They absolutely love the place. Very, very cool, new setup oral surgeon center. My daughter was happy with it. My wife was happy with it. We have her surgery set for actually the week of Thanksgiving so that she's not going to miss any school or have to worry about any of those type things. But the cost of everything that you pay for is for the entire process. So that's going to cover that initial visit all the way through the surgery and all the follow-ups afterwards. So when you're paying for something, you're not going to get nickel and dimed for all of the different things. If you're paying for, you had mentioned earlier, Tim, if you're paying for a house call, that's going to cover all the things that happen at that house call. If you're paying for wisdom teeth removal, that's going to cover the entire process of that wisdom teeth removal. And the list just keeps going on because there are literally hundreds of different things that you can have done, procedures you can choose from, and doctors that you can see through the app.
Yes, sir. No, we're thrilled that you had a great experience. And let me tell you, for the providers that are listening out there, this particular provider is cash only. He has left the system, the matrix, if you will. He's left it completely, and he is booked out, about 6 weeks, I think, 4 to 6 weeks at any given time. He opened up some slots for Laso patients, which is great because he's such a firm believer in the model. But yeah, we're thrilled that you had a great experience, and we're working through on our side. We're working through helping these providers, that have these consultations and then the actual appointment stuff, kind of working through how to present that in the app so it's super clear. But the one thing you hit on that is absolutely the truth, and that's the Laso promise, is that there is not another bill coming. We have one provider here in San Antonio that has a $199 minor procedure thing. If I had known about this my whole life, I'd be a rich man, because this urgent care visit that he does for $199 includes stitches, IV if you need it, the follow-up topicals if you need them for that. So our children always, it's always the kids, right? It's not. But,
right.
You fall and you need stitches or whatever, $199. You're in and out the door. And that is amazing. And I just wish I could tell every mom out there about this and dad, just because of these things that happen on a daily basis. And I know when it happens, it's almost like, even though it's the smallest thing, it becomes this little bit of a life-altering event because of our current system. And all of the things that you mentioned, Harlan, the got to call here, you got to get in here, you got to wait here, and then you're going to get billed anyways after the fact, and that's going to go on for a couple months. And so with Laso, we want to just make it, right now when you need it, and it's right there in your fingertips. And I always like to say, because it's my own personal story. When I wrecked my shoulder a couple of years ago, my doctor said I need an MRI, and at the time we weren't in a position. I said no, but I said no because of the uncertainty. I knew I was going to get a bill for $1,000 or whatever here, and my doctor then told me, no, this place over here doesn't take insurance, but they do take cash, and it's $350. At that moment, I made the decision in a heartbeat, whether I had that money or not. I made the decision to put it on a credit card and go do it, because it had value assigned to it, and it was worth it to me to do. And that's what we want to do with Laso is have that value proposition right there, and have and understand your costs up front. So we're thrilled, and let me tell you, I think that's a good plan, because your daughter's probably the only one that isn't going to gain 5 pounds over Thanksgiving this year. So.
It's one of those funny things. We thought about that, and you gotta weigh it out, right? And say, well, do you miss school or do you? But yeah, she I think she's. We'll have to put some turkey in a blender for her or something,
That's great, man. That's great. I'm glad to hear she's going to get taken care of, though. And like I said, you're right. Innovative place. And to that note too, one thing about Laso is that we, and I think you and I were joking. We were kind of talking prep yesterday. I was mentioning we know we're like Uber. We know we're like Uber in that I'm pretty tech forward. When I personally heard about Uber, I said to myself, I'll never get in a stranger's car. And it's funny, over time, as you know people and that have used it successfully, and like I joked yesterday, they're still alive to talk about it. Everybody else kind of realizes it's not such a strange thing. We know we may be a little early with this idea, but we also know that within 5 years, you're going to be buying a lot of your healthcare like this, because payers, us, the people listening right now, we are by percentage estimated pre-COVID anyways. 2020 was the year that we were going to become the highest payers into the system of dollars, between our deductibles, co-pays, and premiums, and then all of our out-of-pocket expenses, everything we pay cash for. 28.4%. We're the payers into the system. We should be empowered. And that's what we say our mission is at Laso Healthcare. We want to empower healthcare consumers. That's what this is all about.
And you strike a big point right there, because you said earlier you had a Cadillac health plan and you could care less about what the cost was of things then, right? It didn't matter. Yeah. And there are still a lot of people out there that have that. They have those high-end plans. They may work for a large corporation, and they have really good plans. Now, what they don't understand in most of those cases is those plans are now typically self-funded by the employer, and the rates, they have the rates in their hands. Their actions are going to have a direct result on whether or not the rates are going to go up the next year. Yeah. But most folks don't understand how all of that works, and they just think, well, we'll always have this kind of plan. Well, you will.
But they don't
until you don't, right? I mean, we've seen it. We've also seen big companies that all of a sudden next year's plan is like, well, what happened? Why do we have an HMO now, or why do we have an $8,000 deductible now instead of our $5,000 that was still high because we used to have a $3,000? Well, no, we used to have a $200. I can tell you that. I can remember a $200 deductible, and I can even remember a zero deductibles way back. But I can definitely remember it really wasn't too long ago that we had $200 deductibles. But
it doesn't seem that long ago at all. And you're right on the company side. 49% of companies are self-funded now. And I didn't even know that until a few weeks ago. And that's a big deal. And I'll tell you this, I have firsthand knowledge of a major corporation in Texas that has a deal with their insurance company, their provider, and they're self-funded. They have a full-time employee that sits inside of their building and does exactly what the Laso app does all day. When somebody needs an MRI or somebody needs, a lab or something else, this person picks up the phone and calls around town and then calls the employee and gives them their cash price options and asks them if they would like for this person to book that appointment. And that is exactly what this app does. And the way I look at it is this. The people inside of that corporation get this benefit because they work there. Not everybody can go work at a corporation like that. But everybody should have that option. And that's our mission. Everybody should have that level of service. And there's plenty. We can't get to the providers fast enough, to be honest with you. We probably can't get to all the people, the providers, and give them this message because they do want to help. And quite honestly, everybody's really put it on doctors over the years. It's not their fault that they only get 7 minutes with you and write a prescription. That's what's dictated to them by their Medicare reimbursement or by their private reimbursement. They want to practice medicine like the reason they went to medical school, And so what the cash model does for them in this instance is it lets them practice medicine the way they want to. And God bless them for doing it. And we're out there looking for them right now. And like I said, the response from the provider community has been amazing. What we're working really hard on now, and why I so much appreciate time with you today, is getting the message out to people to download this free app, and at least before you go, when your doctor tells you an MRI, before you tell the receptionist to say, go ahead and book me on Thursday or whatever, stop for a second and think about, if you haven't met your deductible yet, in less than 60 seconds on the Laso app, Harlan, I can book an MRI with a local provider, like you said, a couple miles away, and I can save hundreds, if not thousands of dollars on that bill that I'm going to get in the mail later. So, I can book an MRI here for about $400 with a great provider locally. If you go, the average prices for insurance basis around $1,200 and something, meaning if you go in and do your $50 copay or whatever, you're getting that bill. You're getting the rest of that bill in the mail.
That's right.
And so, but again, we don't think about it. We're conditioned to hand it over like a credit card. So our goal right now, and why we appreciate this time with you, is education, because that's what you do, and that's what we need to do as well.
Absolutely. All right, Tim, we got to go to another break right now. When we come back, buddy, we're going to put a bow on this thing. I want to talk a little bit more about that MRI situation too, because I think that's very important for people to understand how a lot of these procedures work whenever you're getting them through insurance, and how those prices can vary and how much money you can truly save if you go through an app or you pay cash in those things. Harlon Pickett, Health and Wealth Power Hour. We'll be right back.
Got FESA? That is the Federal Employees Service Association, and they've been assisting federal employees and the private sector with their retirement benefits for more than a decade, helping you understand your benefits, ensuring that you are not paying for benefits you don't need, and that you will receive the largest retirement check while paying the least in taxes. That's what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlon Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlon Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Remember when His Eminence Dr. Fauci said this?
We have not funded gain-of-function research on this virus in the Wuhan Institute of Virology.
Turns out that was a lie. Under oath, the National Institutes of Health, correcting the record, the U.S. did fund gain-of-function research in Wuhan. Question is, will the highest paid person in government pay a price for his lies? We'll talk about it coming up on the Chris Salcedo Show, 7 o'clock after Lance on AM 700 KSEV, the voice of Texas.
Eagle Care health plan options are about half of what most are paying for a traditional insurance premium plan, plus having control to choose providers and real help getting your health needs met at the most optimum outcome.
Reclaim your freedom to choose. Soar high with Eagle Care. Find us online at eaglecarehealth.com.
Oh, you're on a roll today, Gary. That's some good stuff, buddy. That's some good stuff. All right, Harlon Pickett, Health and Wealth Power Hour. Obviously, we're getting ready for our Halloween episode. Good stuff. All right, Tim.
Yes, sir.
It's great to have you on with us today, buddy. And it's interesting. He's playing all this Halloween music, this scary music. And, you know, deductibles on health insurance are probably one of the most scary things that are out there for folks. And as you had mentioned earlier, it keeps people from going to seek the care that they really need to address things that are going on with them. And it keeps going up every year. It's just part of what we see with the ACA. They're allowed to continue to raise those deductibles every single year. $8,550 this year and going up again next year. And you know, we look at the numbers, and most Americans don't even have $1,000 in a savings account, much less a savings account with $10,000 in it, as it were. Because even though that deductible, let's say you did have that $8,000 in there, well, what if it was an automobile accident that affected multiple members of your family? Well, that's just one person. Now you got to go over to another family member potentially for those same type things. So those deductibles are truly scary. They are a frightening part of a health plan. And when you've got a high deductible plan, a bronze plan, or even an HSA plan, you're not getting benefits. And in most of those plans, you're getting nothing until you've met that deductible. And if you're in that situation, ladies and gentlemen, the Laso app is where you need to go to take care of those things. I mean, you mentioned a minute ago, $199 to go get stitches, to go get a number of things that would be taken care of at urgent care. That's a deal, buddy. That is a great deal.
Yeah, absolutely. And I think, it's the dirty work of the ACA, regardless of politics on it. It is what it is. It's all written word, right? And, as we mentioned, the deductibles, are up probably 200% by now. But it also bears mentioning that they have to raise the cost every year. They are one of the things that happen out of the ACA that a lot of, probably all of it, like you said, you couldn't read it until it was passed.
Right.
Is that insurance companies were locked in at this certain profit percentage, meaning that for every dollar they had to send out 80 let's say 85% or 85 cents of every dollar, pay it out, meaning they can only get 15% profit on that dollar every year. Well, the only way you grow your profits then is you got to grow the pie. And the only way to grow the pie is to keep raising costs. So what we're seeing is never going to abate. It's not going to stop. And you mentioned, I think it was Lending Tree. They surveyed 15,000 of their users, and less than 4 in 10. So, had enough money to pay a $500 medical bill in their savings account. So it's dire. It's really dire. And the other way to think about it too is that I'm not up there, but I'm getting on. But I've never met my deductible. And listen, if I book a chest X-ray and it's $115 through Laso, I book a chest X-ray. Just I need peace of mind because I can't breathe. And let's say I go in there and they find out and they diagnose. They see masses, right? You may have lung cancer. Well, that's what insurance is for. And that's almost all it's good for now. But in terms of health care, it is not. It is health insurance, but it is not health care. But we look at it like health care. You mentioned earlier, we're conditioned and we're trained that way to see health insurance as health care, and it's not the same thing. So what Laso offers is an option. And that's what we ask. And we look at, we look at our brother in arms like GoodRx. We look at them and what they've been able to do is really almost re-educate people to say, hey, stop for a second and just at least take a look at your options before you walk up and either pay that money or hand over your insurance card. You don't have to be, you don't have to be a drone in the system. You have options. And with Laso, we want to use technology to really democratize this knowledge that's been out there for a while, but you had to either work in a large corporation or have a concierge doctor or know somebody like yourself, Harlon, that can actually understand this healthcare system. Those are the only people that knew to ask for a cash price when they walk into a doctor's office. So we want to just bring that straight to you without you having to leave your chair. So,
yeah, that's a great way to look at it. I didn't even think about that till you mentioned the GoodRx app. And I can't even tell you how many hundreds, if not thousands of dollars we've saved over the years just off the amount that we would have paid on our copay. When we had an insurance plan, your copay might be $50 or $100 for your plan, and you're using the app. It's like, it's $12. Wait, what? Why would I pay $50 if I hadn't paid $12?
Hey, I always tell the story, Harlon, that I've walked up to the pharmacist at HEB and she'll ring it up and it's $6. I'll still look at the app.
Yeah, every time. I tell people.
They have me trained so well, and we hope that people use Laso in the same way. When your doctor says, hey, you need an MRI, or hey, you might need to see an orthopedic, orthopedic surgeon for that or something, is say, hey, well, you know what? I'd rather spend the $50, make an appointment for tomorrow, get a second opinion with an orthopedic surgeon. Or, before you dive into the system and because once you're in there, those bills start to generate. And when they come back, hey, listen, I know you mentioned it on social. It's true. We're trying to help eliminate some medical debt in Bexar County by working with our RIP medical debt. We've got $100 million of medical debt in Bexar County in collections, right? That's just in collections. Wow. That's not outstanding bills. That's in collections. 2 out of 5 people in our city in San Antonio have medical debt in collections right now. It's unsustainable. And with Laso, and a lot of that's due to care deferment because you let something go too long and it becomes serious. So, with Laso, we're trying to solve so many things at one time. But what we ultimately really only want to be is the connector between champions like that oral surgeon that your daughter's going to see and people that really need options or they're uninsured and they need care, and other folks, TPAs, companies that are interested in saving money. We just want to be kind of like the wire that connects these things. That's it, the facilitator. We want to, again, democratize the information that's been out there, but more importantly, give people and doctors that direct relationship back. That's direct access healthcare. That's what our tagline is healthcare on your terms, and that's what we mean. The time you want to go, the price you want to pay, the people you want to see, you should be able to choose all that.
Yeah, absolutely. One of the things I want you to hit on, we've just got a couple minutes left here, but real quickly, if you could hit on the myriad services that are available through the app, because it's not just to go to a doctor's visit or go get your wisdom teeth out, but kind of go through a few of the different services that are available out there, because there is a lot of different variety there.
Yeah, we really, we had our eye originally, the things like imaging, MRIs and stuff would be big for us. And we do have a great provider for that. And that one, but man, as we've gotten on, we've wanted to get a special, at least one specialist in everything. And we've had so many sign on, but, man, everything from a bundled, we had one book yesterday, an ingrown toenail removal. And I know it sounds disgusting and everything else, but think about how many of us just let that go.
Yeah.
But if for $200 you can go get it bundled without another bill, would you get it done? And oh, by the way, you get to pick your time. But also too, we've got mental health services on there. We've got dental. We just signed a very large dental provider. But we're coming up on offering, because we're getting approached now, other wellness things, chiropractors, aesthetics at some point. Cosmetics has always been a cash business. Our focus has always been on care, but what we found is that a lot of primary care groups now bring that in-house to help with revenue. And so, man, it's, as you said, it's a myriad of services that we're offering, and we're kind of adding people every day. The mental health was a big request, actually, so we found a couple providers. And if you think about just that one service for a minute, and all the barriers there, let's say you're struggling a little bit, and there's such a stigma on that, but let's say you're struggling a little bit. What Laso gives you the ability to do is book that through the app without having to call around and say, I'm seeking help. You can just book that appointment and go see somebody and get it. But without those little soft barriers to those things, right? And so we're thrilled with the response on the provider side. We just want to get the word out to patients, and we appreciate our time with you now.
Yeah, absolutely. And it's been a joy to have you on, Tim. Folks, y'all can go out and check out the Laso app. Go download it. Go check out stuff, man. It's a good deal. You can also reach out to us if you have questions at eaglecarehealth.com. Thanks a lot. See you next week. Health and Wealth Power Hour. We're out.
Thanks for tuning in to today's edition of the Health and Wealth Power Hour with Harlon Pickett. And don't forget to tune in each Thursday at 1 p.m. to find ways to access and keep more gold for your golden years. Because what it's all about is really enjoying those years and never running out of money on the Health and Wealth Power Hour right here on AM 700 KSEV.